Hi, my name is James Corbett. I'm one of the outreach coordinators with Friend Health, and I would like to thank everyone for joining us for our American Heart Health Awareness Lunch and Learn. Now, normally we would have these events in our Cottage Grove gymnasium, but unfortunately we have to go virtual, which is fine with me. Now, what this lunch and learn hopefully does is that it should bring awareness uh, that disease is the leading cause of death in the United States, but is largely preventable. And you will hear some of the reasons why. But first, I would like to take time and tell you little things about Friend Health. Next. Friend Health is or it was once known as Friend Family Health Center, and it is a federally funded uh, qualified health center on the south side of Chicago. And as you can see on your left side, we have seven locations, and as I said, everything is spread out on the south side. Some of our primary services are, I'm not going to really read them all, but you can see them: adult medicine, behavioral health, gynecology, dental, substance abuse. And some of our other health related service and programs are uh, new nutritional services and the and laboratory. Next, please. As I mentioned earlier, we have two dental offices at 5635 South Pulaski and 5843 South on Western Avenue on the corner of 59th. And what we do here is that we do most routine dental treatments, such as exams, x-rays, cleanings, fluoride, sealants, and oral health education, as well as fillings and extractions. Next. Next, please. Now, I would like to discuss our behavioral health department, and you can see the names of the team members on the left, and we have a behavioral health department in five of our locations. And what we really focus on is that we focus on a integrated health services, which is a combination of primary care, mental health, and substance abuse services. So we do everything. We attack the mind, body, and the spirit. Next, please. Now, you may ask, what will happen, when I come to Friend Health and make an appointment, and I want to see a specialist, and I want to see someone in behavioral health. So sometimes doing a routine exam, your primary doctor may feel that a patient would benefit from talking to a behavioral health specialist. They will meet with the patient while they are in the clinic, and sometimes they would meet with you after your appointment. Some of the questions that they'll probably ask you is about your overall mental health, uh, levels of motivation, uh, depression, substance abuse, or any other issues that that patient may be having. I know I was working on an assignment last week with one of our healthcare providers, County Care, and we was doing a survey on the effects of the pandemic. And a lot of the effects people was suffering from was mental and emotional. You know, I've heard stories about that their drinking is skyrocketed, that they're depressed. So these are some of the people that we would really want our behavioral specialists to really talk to. Next, please. Next. Back up, please. I'd like to talk about our another organization called HRDI, and I'm going to get more into them shortly. But you can see all of the accreditations, certifications, and affiliations HRDI is with. Next, please. Now, HRDI is a subsidiary of Friend Health, and it is a community behavioral health center that that provides an array of prevention, intervention, and treatment health services to address various mental health, substance use, misuse, and community health concerns. And we probably hear and know and even read about, you know, how this epidemic has caused uh, people to really seek behavioral health specialists. Once again, HRDI is anchored on the south side, and it has 13 individual programs and services, but not limited to any present issues. That they have programs that deal with sadness, anxiety, substance use, misuse, dependence, frustrations, and a large array of emotional um, uh, feelings. Next, please. Now, Friend Health and HRDI is school based. They offer school based intervention, crisis assessment. They have locations in Jackson Park Hospital, St. Bernard. They also have a residential treatment where residential group living. They also have centers and treatments for opioid, which is a big issue now, and they have case managers, care transitions. Next, please. HR, as I mentioned earlier, HRDIs are locations. These are a few of them. They're in Roseland at the Community Triad Center, 115th Street. They have a location on Ashburn, 1149 West 79th, and they have a recreational recovery drop-off center on at 1757 East 75th Street. All of these centers are here to help the community and addressing any emotional issues that one may have. Next, please. Uh, we at Friend Health, we accept all insurances. By being a federally qualified health center, we cannot turn anyone away. So we accept, insurance. People that don't have insurance, we have a program called the sliding scale fee, which is a discount program for individuals, those that are uninsured And this is based on household size as well as your annual income. We screen to see what benefits you are eligible for to sign up for our sliding scale fee. The only thing that we ask is that you bring in a proof of income, a valid picture of ID, and a address, a valid address. Next, please. Again, my name is James Corbett. I'm one of the outreach specialists. I work with a team of 3. One of my team members is Conrad Gilbert at 522 East 63rd Street. Phone number is 312-863-0660. Karen Jimmis, she works out of the Pulaski office at 5635. You can reach her at 312-307-2525. And of course, my name is James Corbett. I am out of the Western location. I can be reached at 312-989-5995. I appreciate the time talking to you. And if you have any questions, please on the chat line here, you can reach me. You can say James, Karen, or Conrad. I would like to have more information about the services. Please just leave us your contact information, and we'll be more than happy in getting back to you. Once again, my name is James Corbett, and I want to introduce our next speaker is Dr. G.
Well, thank you, James. I appreciate it. I'll just introduce myself. I'm Dr. Govindarajan. Can everybody mute their lines if you're not speaking? I would really appreciate it. I know this is the first time we're meeting together in a Zoom setting.
Could we change the screen, please?
Sorry.
Dr. G, you were muted.
Ah, I'm talking to myself. That would explain. Thank you guys for joining today. We're very, very excited to be presenting. And this is actually a co-presentation. So this is just going to be a heart-to-heart conversation with all of you. So first off, a huge thanks to an outstanding group of folks that have joined, taken the time on a Thursday to join us, 91 of you here. Some known, some unknown, and hopefully by the end of this 45 minutes, we would kind of sort of know each other. This entire presentation is very, very interactive. Of course, just given the fact that we're doing it in a Zoom format, we can only entertain questions on the format. So are you guys able to see my screen?
No, we've got W. Coombs' screen on. We need to get that off.
Oh, okay.
Whoever that is.
I can see your screen.
Stop sharing your screen, please.
I see your screen.
Can everybody see my screen right now?
No.
No, we're seeing the
I
spread.
can see your screen. It's just when someone else talks, their screen pops up. But when you're talking, your screen is up.
Awesome. So I think, Tony, can you please make sure that you have that figured out?
Now I see you.
Okay,
Okay.
try to share your
Start
screen.
sharing your screen now.
Okay. Alrighty, let's try this one more time.
I can see your screen.
All right, can everybody see my screen now?
Yes.
Yay.
Yay.
Yes.
All right. Well,
Yes.
there's nothing like a little bit of worry to start a conversation on
Yes.
heart. And I think it flows right into our conversation, so all good. So first off, thank you to all of you for coming together on this Thursday and celebrating heart health with us. Typically, as has been mentioned, this tends to be a face-to-face conversation, but hey, COVID time happens, and I'm really thankful that we're still able to meet over Zoom. Today, I'm joined by two of my other colleagues and many of my other colleagues who are also on the line. So a huge shout out to you guys for taking the time during your lunch break to join us, and many of my patients that I'm happy to see. So, and many other familiar faces, friends and family. So today I'm joined by Andrea Williams, who's our stellar nutritionist, and you'll hear from her. And then obviously Liz, Dr. Liz Amarillo, who's our Director of Behavior Health. And you will be, I think you guys have definitely interfaced with her during our Heart Health presentations in the past. And today you're in for a treat with her as she takes you through a mindfulness experience. And I think for those that don't know me, my name is Geeta Govindarajan. I'm one of the internal medicine physicians over here at Friend Health. God, I've been here for a long time. Currently hold the hat of a Director of Clinical Innovation. So excited to spend this next 45 minutes with you guys. So here we go.
I'm so disappointed.
So let's, I think Conrad, we can hear you talk. So let's just have everybody mute their lines and we'll get started. So what are we talking about? We're talking about a heart, a very, very important part of our body, our organ, and we talk about heart more from an emotional aspect of things as well. So we're gonna really, really focus it from many different aspects. And all of this information that we're presenting, we understand that you already know. So this is just going to be a refresher, a sort of a way for us to engage with you on some of the questions and queries that a lot of you might be having. So as we sit there and think about what we're going to talk about, again, a huge request, if you're not talking, if you could please mute your line. It becomes very hard for us to focus. Somebody named Sharon Waters is speaking, so if they can please mute their line, thank you.
Sharon, can you please make me a co-host, please?
Thank you. So at this point in time, we're going to focus on three things. One is going to be mindfulness and the diet, and how kind of all of that comes together as we think about our heart. And that heart belongs to you, to all of us. And what we want to do is what would be the recipes for creating a healthier heart that we all have. So I'm going to turn it over to Dr. Amarillo.
Unmute, Liz.
Hi, everyone, and welcome. So we want to take
Hello.
this time. Could you hear me?
Yes.
Okay. All right. So we wanted to take this time to be educational, collaborative, and to create a safe space to have an open and honest conversation. So let this be like an open and honest discussion of our hearts. What we are doing well, what we need improvement upon, and how we could obtain better heart health. Our hearts and our mind, as we know and Dr. G pointed out, they are interconnected. Both never stop, not even when you're at rest. Today, we will be mindful of self. Today, let's open our minds to how we make decisions that have a long-lasting effect on our hearts. And so with that, we are going to start a meditation. And with meditation, we're going to take a nice deep breath in and ensure that our abdomen is getting expanded as we're taking that nice deep breath in. I'm going to go ahead and I'm going to share some music, some vibes to help us relax and meditate. So as we're taking deep breaths in, I want you to make a note of how you're feeling. Are you feeling anxious, tense, worried? Are you feeling preoccupied in your mind, unable to focus? Have all those slowly drift away as you start to relax your body and your mind. If you feel any tension in your face, your arms, your legs, your fingers, or any other part of your body, tense it up a little bit more, and then slowly, progressively relax that tension. As you continue deep breathing in, and you feel your body becoming more and more relaxed, focus on your breathing and the depth of your breathing. Feel how your breath is going all the way down into your abdomen and then slowly letting it out again. And as we take another nice deep breath in, I'm going to give you your thought for this meditation, which is, I will do one thing that will make me healthy today. And then we're going to slowly breathe that thought out. And again, we're going to take another big deep breath in. And we're going to think about, today we're going to do one thing that will make me healthy. And this might be the only time that you have to take those nice deep breaths. So go ahead and allow yourself to take those nice deep breaths in. We're going to take another nice deep breath. And again, repeating that today you're going to do one thing that's going to make you healthy. And as you're breathing it out into the universe, being open to our body's sense and being more mindful of the breaths that we are taking. So I'm going to leave you today with a poem that connects the heart and the mind by Emily Dickinson that says, "The heart is the capital of the mind. The mind is a single state. The heart and the mind together are a single continent." So let us start by being aware of our bodies and explore our own challenges as we will today in this discussion. So hopefully now everybody's back and now we're able to start our discussion. So I'm going to go ahead and present Ms. Andrea Williams, who will be speaking to you next.
Good afternoon, everybody. Thank you for being here. Well,
Thank you.
Oh, what does diet have to do with mindfulness? And we've got a little short video clip that I hope will introduce that subject to us. Dr. G.
This is one turkey off the course. He's reaching, but he pushes it away. He's approaching a plate of iced cookies. He blows right by him. Oh, the fridge. Looks like he's headed for the soda. Wait, he jukes left, grabs a water bottle. Now he's just got to get out of there. Look what dropped from the sky. Don't do it, Dennis. That's the way you execute a midnight snack run.
So the question, what does your midnight snack run look like these days?
Things brown and
Uh-oh. What we want to make a point of today, and I'm going to use a couple of visuals along with the ones that you'll see on the screen. If nothing else, if you can keep in your minds apple and water. I hope you got to hear some of it. I know the sound might have been a little lower, but the gentleman was doing a midnight snack run there, and they were illustrating it like it was a football, because those were football players. And you saw him avoid some of the less healthy treats that were simply falling from the tops of shelves in his home. And he opted for a healthier choice in the apple and the water. And that's what you might need to begin to consider for yourself when we say, well, what's your midnight snacking? I'm hearing a lot as I'm having visits with patients. I'm hearing a lot about, oh, I've gained weight during this time of being in quarantine. Oh, I'm stressed and I'm concerned about, and I'm worried and I can't get out. So what am I doing? I'm eating. When we're looking at being mindful, we are trying to be aware of what we mean. As Dr. Amarillo was saying, we're talking about being aware of our body and ourselves and what we're doing. And if you've attended any of our past presentations, you know, I always talk about, and yes, I'm going to say it again, we got to eat more vegetables and eat more fruits, at least the not starchy vegetables. We've got to eat more of those in order to help us to stay as healthy as we can. And that's still the message with this Heart Month. We still need to make sure we're eating healthier. And it just so happens that those not starchy vegetables and our fruits have not only the benefit of giving us the vitamins and minerals and all these other nutrients that our body needs, but those vitamins and minerals and some of those nutrients are very heart protective. And so we get the benefit not only of enjoying how good they are, but we get the benefit that they are helping our bodies to stay healthy, helping our blood pressures to stay in a healthy place, helping our cholesterol, because guess what? There's no cholesterol in the vegetables and fruit. Only what we're adding if we're, for example, making greens or string beans, because I know some folks may have Southern roots here, and we may put some meat and things into that broth that we're using to make our greens or our string beans. And that's where we're adding and have to be cautious about having too much fat and cholesterol and salt added there. And all those things are part of what we want to make sure we're doing to stay healthy, is not letting the good get mixed in there by having too much of those elements, sodium, fat, cholesterol, which we know do affect our heart health. So we want to push the fruits and the vegetables, eat more of those. They also have the benefit of not being high in calories. Yes, it is better for us to eat our fruit than it is for us to drink it. So stop drinking so much juice, particularly if you look at the calories that come from the foods that we're eating. This is another part of being mindful. That gentleman could have picked those, they look like kind of M&M kind of chocolate candies. He could have picked the cookie with the frosting on it. He could have grabbed that bag of chips that fell down, and he could have been eating those. The calories that are in those kinds of foods related to the, if we were trying to balance these things, related to the nutrients that are come out of those foods, it's very uneven. You'd be getting a lot of extra calories and not a lot of nutrition from those food choices. So indeed, if you think about just on average, like a handful, which is usually what you see as a portion on various chips, it'll say 1 ounce or about 13 chips can be anywhere from 150 to 200 calories. And if you looked on the food label and noticed if there was any of the vitamins or mineral content there, you'll notice that it's very low. There's not fiber there, and there's not many of the vitamins and minerals that we need. There's just a lot of calories in the form of fat. For every 100 calories, and this is just an estimate because people burn calories at different rates, but if you had 100 calories worth of food there, it would take about running or walking a mile to burn those 100 calories. It would take about 30 minutes of lifting weights to burn those calories. Or on an elliptical, which, you know, on an elliptical, you're moving all the parts at the same time, your legs and your arms, takes about 10 minutes on that. So when you look at, well, what am I putting in my body? What am I feeding? What am I fueling my body with versus how much nutrition are they giving me? If it's not giving you nutrition, then it's just giving you extra calories, which is going to add on extra pounds. And so like the gentleman did in the refrigerator, you remember we saw all those cans of soda around? They had all those cans of pop. You figured about a 12-ounce can of pop is anywhere between 120 to 140 or more calories. So you're going to walk a mile and a half, need to walk a mile and a half to burn off those calories from just drinking that pop. So what did he go for? He went for the water. 0 calories, a whole bunch of good stuff that our body needs right there in the water. A lot of nutrition right there. And many times when we think we're hungry, we're actually thirsty. We're in the middle of our winter. Well, hopefully at the end of our winter. But during the times when our heat is on, we could be dehydrated. Heat is going, it's a dry time of year anyway. You might need more water. Sometimes when you think you're hungry, you're just thirsty. So try water first. Be mindful. Am I really hungry? Didn't I just eat something a few minutes ago? Let me drink some water. Give yourself some time. Be mindful that you're trying to make sure you're putting in your body the healthy foods. So drink your water, eat your fruits, and notice the size. I know this is not the best, but notice the size of the apple. It's not, you know, if you got a big one, okay, cut it in half, eat it, maybe save the other half of it. But let your food, as it says there, let food be thy medicine. Take in the good stuff. Yes, you can visit Dr. G, but you don't need to visit her because your blood pressure is high. I mean, if it is high, come and see her. But try to help by making sure the selections that you're making are not creating part of the problem. And if it's not an apple, maybe it needs to be an orange. What do you think, Dr. Amarillo? It could be an orange too, right?
Liz, are you on?
Yes, I am.
Okay, thank you.
So again, we want to be more mindful of how stress and situations and relationships and motivation play a part in our mood. And in turn, how we feel about the food that we eat. So let's take a moment to look at the orange. And if you are not able to see the screen, we're gonna imagine an orange. And so take a moment to let yourself imagine an orange or maybe a fruit of your choice that you like. Close your eyes or you can leave them open. Now take that orange into your hand in your imagination. With your fingertips, feel the orange, the texture. If you were to describe the texture, is it lumpy? Is it dimply? Is it rough? As you're studying the orange with your sense and of touch, you could almost get a swift, a little faint smell of citrus. As you begin to peel the orange, you could feel all the textures underneath your
Sound is down.
And you are able to feel that now the texture of that orange, it seems more gentle now. You're able to feel the contours and the rigidness. Next slide. As we continue to pull deeper, you're able to smell the orangey citrus has gotten stronger. Does that orange bring anything to mind as you're peeling it? Does it bring you back to a childhood memory of when you first ate that fruit? Does it bring you back to, how you savored the fruit before you actually put it in your mouth? So as you're peeling the orange, as I am doing physically, take time to smell it. Take time to take a piece of that orange and put it against your lips. Your lips are able to study the orange in a different way because they perceive touch with more sensitivity than the fingers. Now, as you take another deep breath, in your mind, bite or place the piece that you took away from the orange into your mouth. Before you're able to chew, sense the texture with your tongue. Guide the orange to where you want to chew it, the right, the left. As you take that bite, you notice the sweet citrus that is released on the first few bites. You savor at each bite. Be aware of how many times you're able to chew the piece of the orange before swallowing. As I bring you back from the orange, I want you to be aware of how using your sense and taking the time to be mindful makes you feel. So if you have any questions, you could put them in the chat box, and we will see them as the presentation progresses. Your mind and your body is connected to your heart. This is a known. So we need to know how stress makes us feel. James brought up the pandemic when he was first started us off. And the pandemic has caused us to be isolated. It has caused us to, have many other emotions that might have not been up before or brought up before. It's caused us probably to go to the refrigerator more often or go to our unhealthy foods just to make us feel a little bit better or to try to cope better with the situation. So we have to know, how everything around us is making us feel and how it plays a role in our relationship with food and how we're coping in that relationship. And so I want to take a focus now, and if you're not able to see the questions, it's okay, on the screen. In the last 2 weeks, or even in the last few months, have you been experiencing little, not enough, or too much sleep? Or have you had experiencing any difficulty falling asleep? It's a yes or no answer. Keep a note of that yes or no. Has your appetite changed? Either having poor appetite, not really having an appetite or eating, or overeating? Have you been experiencing difficulty in focusing or concentrating more than usual? Which means, like, if you're watching TV, are you able to sit down through a whole program or through a whole movie? Are you having difficulty while you're reading? Having to read things several times to be able to understand, even though it's not something that would normally take you as long. Have you been feeling hopeless at times? Have you been feeling tired or low energy? And so as we explore these questions, because these questions are all associated with mood. Our mood changes how we sleep. If we're too anxious, then we might not sleep at night. If we're too preoccupied in our thoughts, that might not help us sleep at night either. One thing about not sleeping is that obviously it creates insomnia, right? And if anybody knows a little bit about insomnia, is that it craves your appetite. And so sometimes it increases your cravings. So if you're trying to get on the straight and narrow, and like Andrea pointed out, being more mindful of eating more of one thing than the other, if we're not sleeping well, that's going to be more difficult to do. So even when you have an appetite change, if you get into an argument or a fight or a disagreement with someone, it might crave your appetite to not eat or to eat a little bit much. Or if for any reason you're feeling lonely or you feel you don't have enough support, that would also crave your appetite. So it's important that we notice these things. Difficulty with concentrating. So, I don't know anybody who doesn't multitask. And so sometimes people could have difficulty with concentrating and not know that it is part of mood. It is actually, if people are having too much difficulty concentrating because they're not sleeping well, because they're not eating well. So it's all interrelated. And so it's important that we continue to keep a mindful track of it, because when we do come to see our providers, we want to make sure that they're aware of everything that's going on with us, and not just one single symptom. Also, sometimes we could feel hopeless. I know in this pandemic has brought up some people feeling hopeless because we are told to socially distance, we're told to socially isolate from other people. And so, and not seeing hope in sight. And so are you feeling hopeless, or are you feeling helpless that you're not able to do much about your situation? And so it's important to be able to gauge how that makes you feel and what are your reactions as a result of how that's making you feel. Are you eating more? Are you eating less? Are you sleeping more, sleeping less, having difficulty tossing and turning in the middle of the night? And so it's important to keep those noted. The next question was, have you been feeling tired or having little energy? So therefore, if you answered yes or no to this question, if you answered yes, well, if you answered yes to all of the above, how could you not feel tired with low energy when you're already, having difficulty sleeping, you're having difficulty concentrating, you're experiencing, difficulty with your appetite, either overeating or poor eating. And so it's all interrelated. And so that's why we really have to assess our mood and how we're feeling about that and how that's making us feel. And in return, what our relationship with food is as a result of how we are feeling in our body. So being really mindful. I know for me, because of my medical conditions, I know that I have to eat a lot more healthier than most people because I don't want to get sick. And so therefore, making sure that, we have proper snacks. And what do those snacks look like? And as Andrea, pointed out, her snacks that she keeps, I also keep various snacks in my office. So, preparation is key. And so even when you're having a stressful day, like, what are the snacks that are going to be healthy for you? Is it that banana? Like, okay, I got the banana, I put it in my purse, or put it in my car. Is it going to be that apple? And so, or is it going to be the orange? Something that's fast, that's easy to grab, and that way we're not like, okay, well, let me pull over here. That's $1, and I could just eat it really quick, just to satisfy that craving, and to make us feel better. And that's why relationship with food is so important. But also all these symptoms that I mentioned about sleep, about your appetite, about focusing, and feeling tired and low energy is also, could be as a result of medical conditions. And so that's why it is important to make note of these and talk to your medical provider. Ensure that you visit and speak to them honestly and openly so they will be able to decipher if you're having any depressive mood or any anxiety that they're able to help with and be able to refer you appropriately. And so with that, I mean, who better to talk about, the medical component of good heart health than Dr. G?
Thanks, Liz. As you were, I think there were a couple of points that she mentioned, which I think is worth, revisiting again. I think between the three of us, I think one of the things that you will constantly see us reinforce is the idea of balance. And balance is really the key to life as we try to juggle, 10,000 things in our hearts and our minds as we try to navigate through a pandemic, protests, and what have you. I mean, it's been a difficult year, and I think just understanding that and recognizing that for you and still figuring out what is the best way that you can still maintain parts of yourself through this process becomes very, very important. And sort of thinking what we wanted to really, when we were thinking about how to structure this, we thought it was interesting to sort of take the mindfulness component to it to the nth degree. So as you saw, what we saw Dr. Amarillo do was really take us initially into a deep dive inside our own self, just at least even taking that 2 minutes to breathe and recognizing that, hey, I exist and the rest of the world has stopped existing is so necessary. In the same vein, I think what Andrea did beautifully was to sort of take us through that experience of picking the right food. Each moment we have that choice of picking and choosing what we want to do, whether we choose to exercise, not choose to exercise, whether we choose to pick up the food that's going to make us feel good in the moment versus not do it, take something else that's more healthier. It's a choice that we make each and every single day. So when you think about that mindfulness component, you realize that your body itself is this component of your mind, your body, and your spirit, and all of them are kind of work hand in hand. And as we focus in on our heart, we know that there's that emotional component that the heart is made up of, but then there's that physical component of it, that which you can hear yourself breathing. Just want you to take a quick second and just put your hand on your heart, wherever you are right now. And I think we can all do that. And just, offer your gratitude to this organ that's working like day in and day out, whether you want to ask it or not. Think about what a thankless job that it has, where we're just going about our business. We don't even realize that it's beating. We only realize that it's not doing its job when we get to a point of dis-ease. And that's kind of what we're trying to prevent you from coming. And I think Andrea mentioned a wonderful part. You don't want to come to see your doctor to say that you have a problem. You want to come and tell your doctor, hey, I've fixed my life and I just wanted to let you know about it. And I've had plenty of patients who have done this over time. People have stopped smoking, people have lost weight, people have taken up meditation, what have you. So I think we as human beings have the ability, if we make the right choices, to do the right thing. So a huge shout out to the hearts that beat and keep the blood going through all of our bodies. And our vascular system is pretty cool. It's about 60,000 miles long. Did you ever even know about it? So things to think about. What this is actually showing is that your heart is also an electromagnetic component. Your aura and your energy can spread out at least 3 feet outside of your body. Did you even know that? And this is kind of the whole idea of like when you come into somebody else's sphere, that's when you realize like, hey, I feel that vibe. That vibe is why, because your heart is not only a physical functional organ, but it's also an electromagnetic organ in the sense that you can feel. And this is why the EKG works. It doesn't matter where you place the leads in your body, it works because it's capturing that electricity. And so I think it's a pretty darn cool organ. And the thing about our body is it's also super resilient. Why? Because it gives you so many chances before it goes crazy on you, right? When we think about heart disease specifically, the body gives you many hits. It says, hey, you're gaining weight. Hey, your cholesterol is growing high. Hey, you should stop smoking. You're starting to cough. And, your eyes are having issues, etc. And then it gets to a point, it has resiliency. It keeps on taking the hits, but then it comes to a point where it's like, I'm not going to do this anymore. So I think where we as human beings have a high option is in the early phases. And that's why prevention. And if we can take anything away from the pandemic, is that prevention works, right? You wear your mask, of course I'm inside, so hence I'm not wearing my mask, but wear your mask, socially distance, wash your hands. I mean, COVID can be stopped, right? And we've done that now, whether forced or enforced, we've done it. So why not apply the same thing to your heart disease or any of your chronic medical condition? We have the ability to stop it if we choose to do. So that's kind of where your mindfulness piece comes in. I'm going to quickly run through some of these slides that you guys may have seen before, but the part that your body, your heart, exerts this pressure on the walls of your vessels, and that's kind of what we measure in form of blood pressure. So externally, when you come to see a doctor, we give you numbers. Here's your systolic, here's your diastolic, here are some numbers that you need to really know, and here are all the things that you need to do. The beauty of blood pressure is that if you do things right, you maintain your low salt diet, you take your medications if at all needed, if you exercise, you can keep that blood pressure low. And that's a very indirect way of you to know that, hey, I am doing well. So it's a great marker that we've been using for years to make this happen. And the reason why disease happens is when we do not take advantage of the foods that we have a choice of picking. So when we are eating a lot more fatty foods, there is the layer of fat that starts to develop on those arteries and create what we see as a plaque, and that plaque flicks off and can lead to a rupture and can cause a heart attack, or it can cause a stroke, or it can cause what we call peripheral vascular disease. And what we've all learned in this whole process is that we have the ability to modify the risk factors that put us at risk for developing these heart conditions. So diet, as Andrea spoke about, tobacco, exercise, and stress. And stress is something that Dr. Amarillo just reinforced to us. So how do we manage that stress? Knowing about yourself, recognizing that this is what are the factors that are leading me to stress, and how can I get back to that centered space that allows me to react to the conditions that I have, becomes very, very important. So just to quickly reinforce, what are some of the risk factors for coronary artery disease? Now, this is kind of where I need you guys to just type into your chat boxes, and whoever is able to see the chat box, if they can just shout it out to me, their Bishwas, Dr. Amarillo or Andrea or Karen or Tony, whoever can just shout it out. What have people written so far? What are some modifiable risk factors? I gave you the answer in the previous slide, guys.
Someone typed in, yep, stress, obesity, overweight, diet, stop smoking.
Excellent. So those, so high blood pressure, smoking, yes, cholesterol, yes, and lack of physical activity, obesity and overweight. So ding, 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 ding. So all of you that entered, thank you. And diabetes also, which is another chronic condition that happens and goes hand in hand with high blood pressure that we see. So these are all things that we have a choice, again, of making. There are certain things that we don't have control over, the genes that we have inherited, but even that can, fall in the background if we are able to take care of some of these modifiable risk factors. The non-modifiable risk factors are obviously our age, gender, family history, genetics, and race. And if your body has suffered previous history of stroke or heart attack, it puts you at a slightly increased risk than the rest of the population. So knowing your body, knowing yourself, and coming into the doctor to check in to see kind of the status of your body is equally important in this whole process. So if we had to sort of, summarize it, I think I always love this thing that one of my spiritual teachers often emphasizes on. Our human society right now is stuck in this mode of hurry, worry, and curry, right? And curry, just because it all rhymes together, but curry could be insert any of these not so cool food that Andrea talked about, to stay away from those. And tobacco is truly one of those things. And I've had plenty of my patients who stopped smoking in the last year, and shout out to you guys, and you know who you are. It is never too late to stop, you guys. It's never too late to stop. 20 minutes after you stop smoking, your blood pressure decreases. And imagine in 1 year, the added risk of heart disease declines to half of that of a person that still continues to smoke. And we've seen how smoking also has impacted those that have had COVID. So why would you do that? Why would you spend the money that you could be spending on healthier foods or even a patch than, pick up that cigarette? Exercise. How many of you are exercising? Just either raise your hand with that thing that, I think there's a button in your Zoom that you can say, if you are managing to do even 10 to 20 minutes a day, shout out to you guys, because it is so important. Our goal is to get to 150 minutes a day, 150 minutes a week. But even the littlest of steps matters. Littlest of step matters. And if you do, and nowadays we have all these apps in our smartphones that can tell you how many steps you took, even if you get 10,000 steps, 20,000 steps, 50,000 steps, that's all that is needed. And this gadget that we have, the phone that we use to look for all our social media and whatnot, is also a wonderful tool for us to document what your blood pressure is, what your, how many steps have you taken, what have you eaten today. There's so many apps from the American Heart Association that you can just download for free and monitor yourself. You don't have to pay big bucks to get on. There's so many free fit apps. Even if you can't get to a gym, you can just download these apps. You have yoga, chair yoga. You have, at home open fit options that you guys can just download. So there's no reason to spend huge amounts of money to, make you look good. It's just the simple steps, and your body will thank you for it. Knowing your blood pressure is important, because once you know your blood pressure, it becomes very, very key to knowing how you're doing, right? So the goal blood pressure right now is you want it to be as close as possible to 120/80 as you can. And if you're in this range, and the thing about blood pressure is that it's very dynamic. So I would encourage you to speak with your primary care physician to make sure that you get a blood pressure monitor at home and monitor it, at least once a day or once a week, depending on where your blood pressure range literally sits at. And that mindfulness piece. And I cannot emphasize, I mean, right now, even at work, we have this wonderful way that we all start our day at work, which is basically taking a minute, literally a minute to, center yourself, do a mindfulness piece. And Dr. Amarillo leads us through that session literally every week and every day in some of the huddles. And honestly, this was something that we initiated when COVID pandemic happened. And it just kind of brought us together. It didn't matter, what your religious or spiritual beliefs are, or if you didn't believe in anything. Centering yourself just allows you to focus on you. That self-care part becomes so very important for us, because you become aware of things that you're reaching out for, your own mind. It stops you from racing, stops you from reacting, and it allows you little pieces. You can do journaling, and a lot of folks have seen that. You've seen calm apps that have come up, and these are simple things that you don't have to turn to pills for. I mean, this is available again at your fingertips through apps. It can be in any of these. If you Google meditation, there's 10,000 YouTube videos on meditation. So these are simple, not so expensive, do it at your home, at your pace, interventions that you can even emphasize. And the reason this is because at the end of the day, you are responsible for you. There is nobody else. Yes, you have family. Yes, you have your significant other or what have you. But at the end of the day, it doesn't matter whether I know I've had so many of my working mothers who say, I don't have time for myself. I have to run after my kids. But at the end of the day, it's you, my friend, you. And what you say to yourself every day when you look at that mirror is all that counts. When you talk to yourself in the mirror, are you saying, I am? Whatever you say after that, whether it's beautiful, I'm empathetic, responsible, kind, powerful, Those are affirmations that your body is hearing, your heart is hearing, your mind is hearing, and it makes a heck of a difference. So just like you're doing a physical gym for the purposes of making sure your body is fit, you need to get into that spiritual gym as well, where you're telling your body, you're telling your heart, you're telling yourself, I am whatever that I am is after. And never sell yourself short in this process. Yes, there will be days where you take 5 steps and there'll be days where you take 10 steps behind. But at some point in the time, you have to come back to that middle ground and, be forgiving of yourself. The beauty of all of this work that you're doing, it's a multiplier effect. We know that if you have one risk factor, it doubles your risk of getting heart disease. If you have 2, then quadruples your risk. But the thing is, once you know what your risk factors are, there are ways to prevent it. And that's what the body, the mind, the heart keeps telling you that. It doesn't have to be this one day in February that we all come together to talk about this. This should be an everyday conversation. And what we've presented today, it doesn't even scratch the surface, right? Because we've only given you snippets of things. Each one of our topics can be a whole different, working conversation. But just recognize that simple things that you're going to do is going to have a multiplier effect for your body. It may not be right this minute that you're going to see the impact, but you will see the impact. And you guys are all living testaments of it. Those that I've had the good fortune of interacting as patients, as colleagues. I mean, you guys are inspiring. And to sell yourself short for any other reason would just be utmost travesty. So please stop smoking if you are smoking. And the thing, if you are listening to this today, I think it also, I'm putting this on you to also be the change agent. Take this information back to your families, to your communities, and be that vocal person that goes out and shares this message. Because it's just not a Dr. G job or an Andrea job or a Liz's job. It's everybody's job. Because this is simple stuff. This does not require an MD or whatever degrees behind your name. This is simple stuff that you guys know. So the question is, how are we going to now make that change? Health, at one point there was something called Healthy People 2010, then it became Healthy People 2020. Now it's Healthy People 2030. It doesn't have to be till 2030 that we assume our health and become, healthier communities and citizens, but it can start today. And even that little step that you take today is going to be worth it in the long run. So I guess the question is, again, back to the mindfulness, am I making an effort or am I making excuses? People do have a lot of barriers and people say, oh, I don't know, I don't want to stop. I don't feel like exercising, but start simply. Once you make one impact in one sphere of your life, the other one will automatically fall into place. So back to the same slide that we started our life with, our presentation with, which was basically this interplay between what are our choices? Am I going to choose to eat mindfully? Am I going to choose to, get that can of Coke that's been calling out my name? Am I going to choose to exercise even 10 minutes, or am I going to choose to just, sit on the couch and watch that next Netflix that comes along? The choice is yours. Is your mind full, or are you choosing to be mindful? And somehow figuring out that space in your mind to clear your brain off things and just being and just listening to your heart or your breath or just nature, whatever floats your boat. It is very, very important because all of this, and now research has shown constantly that this is the most impactful way to live. So I implore you, I challenge you, I dare you this year to really take a look at your heart, feel your heart once more, put your hands on your heart again, feel that heart beating, and I invite you to take the best care of it, offer it gratitude for the work that it's doing, offer gratitude to this body that has, held you for this long, and do what is necessary to keep it healthy, happy, joyful, and kind. So we'll be happy to take any questions. And thank you all for continuing to stay on. I know it's way past the time frame that everyone this slot was allotted to. So I'd like to thank the outreach team for giving us an opportunity. I'd like to thank the organization for giving us a space to share. Happy to do these Zoom sessions because I think it's just the more conversations we have around this, the better. So thank you. And it'll be kind of cool to see everybody. So I don't know, like I'm going to switch out of this mode right now. And then I would love to see everybody on a gallery. So if everybody has their videos on, I'd love to see everybody who I'm chatting with.
Hi.
Anyone have any?
Hi.
No questions.
I put a question in the chat. It's a little off subject, but this is Friend Health. Does Friend Health have any info on when and where we can get the COVID vaccine?
So that's a great question. We also serve on the COVID team, so I can answer that question. So yes, so you should, right now we're focusing on our 65 and older population. We have, there should be like through the outreach team, you should be receiving a portal message. And also I guess they will be putting something on the website saying when it's ready for essential workers as well as for those with chronic disease. As you know, the city is moving in that phase. So yes, we should have that available. And I'll also open it up to anyone else. I don't know if Mohammed is on. Mohammed, are you able to, share a little bit about the COVID
He got
vaccine?
an empty chair.
Oh, he's got an empty chair. Okay. All right. So we'll. Yeah, go ahead.
I'd like to ask a question.
Sure.
I wanted to comment on COVID. If you live in 60629 and 60632, which is Gage Park, Pulaski is offering the vaccine today, tomorrow, and Thursday. You just need to call and make an appointment.
Okay.
Are there any questions on the chat? Can anyone just kind of summarize that for me?
Dr. G?
Yes.
This is Ellie. I did go ahead and put a note. Is there any way we can go ahead and get the pinpoints that you were giving out? Because they're very important, but we can't, I mean, it's like so much information that it would be very good for us to go ahead and always keep safe, like maybe put it like in a refrigerator, somewhere that we can see it to help us out. Because sometimes, to try to remember everything, when we come into a situation like this, like me, I'm trying to lose weight. And that's one of my major concerns that I think that I'm sometimes when I go to sleep, it's just stuck in my mind. And it's always like a big concern to me, like thinking I'm going to end up with a heart attack if I don't lose some kind of weight and somehow. And I try to do a little bit of everything as you were mentioning, what all the three of you doctors mentioning this, but it's very hard sometimes to even seek any kind of results. So, my big concern is like trying to avoid becoming diabetic and then getting any other, high cholesterol, high blood pressure. And so I like these pamphlets. I would like something like that to get, like so I could print it out or have it like something that was,
No, I think those are all good points, Ellie. Thank you for your suggestions. I think that's a great takeaway that we can offer. So what I would recommend that the outreach staff does is actually take, create some sort of a pointer based on our presentation and post it, and also send it back to the same folks that they sent the emails to. So I think that would be helpful. So yeah, we can definitely do that. So point taken.
And this video will be available on our YouTube channel before the end of the day. So if you ever want to come back to get notes, until we
Okay.
make it into a physical form. You can come back to our YouTube channel and watch.
I have a question, Dr. G. This is
Yes, go ahead.
Enrique. My question is, okay, about the fruit and the juice. Okay, so what, I know you eat too much fruit, it turns into sugar. Is that correct?
Yeah, so there are certain
On a day,
fruits
okay.
that are high in fructose content, right? So just
Okay.
recognizing that, apple for sure, and it's not out of the context for people to say an apple a day keeps the doctor away, because I think that of all the fruits, I think it has the lowest sugar content compared to watermelon. You can imagine it's sweet. Strawberries are sweet. Grapes are sweet, etc. Sorry, Phyllis, do you mind just muting your line, please?
Okay, and my next question, pertaining to that, I thought juice. Juice. If you're gonna drink juice, should you drink concentrated or pure? Which one is better?
Concentrated, again, anything that's processed by any of the, anything that's coming straight from Mother Earth is probably the best thing to do. So if you had a choice, that would be the way to go. Any concentrate probably already has some processed stuff. So it might have sugar, it might have fructose, etc. So that might just be adding more, additives to it. So I think, yeah, so if you can get fresh fruits and then make it into a juice, use a juicer to do that, I think that would be much, much better. But between the juices, the concentrate versus a juice, I think they're probably similar. And I would definitely, probably have that conversation specifically with Andrea as well. I think she's already left for the Zoom session, so she's not here to answer that specific question, but that's a great one to, ask her. But as far as if you had to pick and choose all of your options, I think going with, the au naturel way is the way to go.
Okay, I have a question. I was trying to use the hand raise feature because that's what we've been encouraged to use in my Zoom conferences, but
go ahead.
It's going a little different here. So my question is in regards to the healthy heart, because I'm 35 years old, I'm currently pregnant, and every doctor's visit, and even in the past, I've always had a good blood pressure. My heart rate was good and everything like that. There was no elevations ever, but I suffer from severe insomnia. And I know that my grandfather, he was a carpenter as well, and I'm a carpenter. Up until the age of like 61 or something, he died. And then my aunt, she just recently passed away too, but she was kind of obese. And I'm a little bit on the plus side now because I had another child over the age of 30 when I was 31, and this is the second one. And just in regards to having a healthy heart, because I do have to have a C-section with this baby, because I had one with the last one, having one over 30. And dealing with this insomnia, and correlating it with my heart, because I feel like, I tell people that I have severe insomnia, like I literally get no sleep. Like I see every hour go by. Like if I do happen to fall asleep, I'll wake back up before the hour ends, and I'll see each hour pass. And I still have to work. I have to maintain my house and other daily activities that people, pull me here and there, everywhere in the world. So my question is, because people always ask me, if you have severe insomnia like that, how are you still alive? It's through the grace of God, I know. But in regards to my heart, how does that relate, having such extreme insomnia? Like, would that over time, like, could it just suddenly stop or something? I'm just curious to know, like, what relation does my insomnia, and have you ever heard of such a scenario before? Because they put me on Ambien, Lunesta, none of those things work. They told me to stop taking it because it was only supposed to be for short term anyways, and it could start causing other damages to other organs. So that was many moons ago. I've been dealing with this for over 15 years now. And I feel like at this point, it needs to be addressed, but what exactly needs to be addressed, I don't know. I don't think there's any underlying, depression or mental illnesses that I'm suffering from. Things happen. I deal with life on life's terms, but I'm dealing with this insomnia, and I feel a stress from it. having to still do my daily tasks. But every time I go to the doctor, my blood pressure is perfect. My heart rate is perfect.
So, so it's a really good question. Yes, there are people that do suffer from sleep disorders. And I think one, I mean, if it's something that's just inherently, something that you see cyclically happening in your family, I think that's worth noticing. So I'm glad you've done kind of like the workup for what all the things that you're doing. And I think ruling out like the things like, you've tried the medication, you've tried your blood pressure, everything is okay. Over a period of time, yes, it will have impact on your body, right? Because in general, at some point, your body needs to reset. And,
Right.
and I mean, right now, maybe you're going off on an adrenaline, escalator, but at some point it's just going to be like, and I think even though you've said, that maybe you've ruled out stress as a lower risk factor in your contributing towards it, our mind does have something called a reticular activating system. And that's what kind of helps us process things. And this is precisely why in this generation of folks, which are constantly on social media and what have you, the reticular activating system is at a heightened state of awareness. So as a result of that, now people are, constantly having struggle, going to sleep. So it's so important to shut that reticular activating system down by doing some of these things like meditation, by like switching off things. I mean, when you are like watching a really boring movie or when you're like sitting in a dull environment, you have no choice but to go to sleep. Why? Because there's no stimulation, right? It's that same. So what you may need to do in your particular case is one.
I've done that. I turn off the TV. I stay away from social media. I don't really be on there anyway. So there's nothing much on there. I scroll sometimes. I can see myself being bored and scrolling, and I see the same thing, and I'll shut that off.
But even you should not be scrolling at all. So you should pick up a book.
I'm saying, like, but that's even more recently. Like this has been an ongoing factor even before social media came into existence.
So I would then say that maybe having a conversation with your primary care doctor and just making sure that you schedule an appointment with a sleep specialist, because there are sleep specialists.
They sent me there.
So and having that conversation with them, and then they monitoring your sleep to make sure that what level of sleep you end up going into. I think that would be something for you to like look at it individually. But yeah. So I think, your point well taken. I'm glad you're mindful of what your body is going through, but I would definitely argue that, there are other things that may not have been looked at. So I would say a consultation with the sleep physician would be the next step. If you
So my question is, with the healthy heart thing and the number that you guys provided through you and your counterparts, is that something that you guys assist with, or should I go directly to my primary physician and
So you should go to your primary.
So what do you guys exactly do? What is the numbers that you guys provided, like for?
I think
Mr.
that was
Colbert and James and the rest of
So they're just the outreach team that oversee information about Friend Health. Friend Health is a community health center. And so we have mostly primary care physicians and behavioral health specialists and dentists. So if you already have a primary care physician elsewhere, you should continue to go with, to meet them and then request a referral to see a sleep specialist. That would be the next step for you.
Okay, thank you.
Okay. Any other questions? Yep.
We're going to have to make this the last question.
Okay. Okay. Any other questions that are
I
coming?
don't know how to get on, but can anyone hear me?
Yes, Ms. Cheryl, we could hear you.
Okay. I was told by my primary care doctor that I was borderline diabetic. And I was talking to a friend of mine about that, and she was telling me to be cautious about bread. Does bread factor into whatever?
Yeah, so bread is actually, straight up carb, right? So carb then gets broken down into, glucose eventually. So that's kind of where puts you. So the more starchy foods we eat, so pasta, bread, etc., all kind of eventually get broken down into, glucose and fructose. And so that's kind of where it becomes very important to manage that. So if you're really interested in eating bread, it has to be whole food. Whole wheat bread, as opposed to like flour-based bread.
Okay,
So those are little modifications that you can make.
I
But
wouldn't have to completely stop eating bread just if I do
no,
eat
I
it
mean, that's
whole
the
wheat.
thing. I mean, the thing about everything, as we talked about today, is just about moderation, right? Just recognizing
Okay,
that like
okay.
no one is telling you don't stop eating salt. I mean, that's impossible. Come on, there's salt in everything. So what we're saying is that don't reach for that second bag of chips. Don't reach out for that, you know, even with soda, okay, once in a blue moon is okay.
In
But
moderation, okay.
but if you're drinking soda every day, you're just risking yourself. And I think what Andrea was speaking about was just look at the content. If you actually read the content of what is made up in a food, your 2 gram, your little, like those snack packs that you give your kids for chips, that
Yes.
has about 2 grams of salt in it. So imagine if you had a big pack of chips, or you had a tub of like whatever, ice cream or whatever, you're gonna already finish out the quota that you need for that day. So that's what that means. It doesn't mean you stop eating salt or you stop eating sugar. I mean, we should enjoy life. I mean, we're here in this earth for to enjoy as well. But just knowing when to stop, knowing when to say, hey, you know what? No, 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 not right now. I think that's the key. And I think just that mindfulness piece that I think Dr. Amarillo kept on stressing is got to be the key to it,
Hey, Dr. G?
Okay,
yes.
thank you.
Sure.
Dr. G, this is James, and we're going to have to wrap it up. But we want to thank everyone for attending the Lunch and Learn. Hopefully someone got something from it. I know I did. And in closing, I want everyone to hang on, because we are going to be doing a raffle, and it's called Spin the Wheel.
Okay.
And if,
Okay.
Thank you.
and if Tony is there, Tony, are
Yes,
you
I
there?
am. I'm sharing my screen right now. Can you guys see the screen?
Yes.
Yes.
Great. For this raffle, unfortunately, Friend Health employees cannot win. So if you are an employee and your name pops up, please just let me know so that we can go to the next name. And also, if you do win this prize today, if you don't feel comfortable with dropping your email address in the chat, please email friendhealthmarketing@gmail.com. And that email address is in the chat as well, so that you can claim your prize today, okay?
Okay.
All right, let's get started. William T. Do we have a William T still here? Do we have a William T who's still here? All right, so let's give him a second. All right, let's get spinning it again since he's not here. Hey, Gabrielle B.
Yes.
You do? Okay, great. Do you mind dropping your email in the chat, or do you want to just email us to get your
I'll drop it in the chat. Thank you.
Okay, great. So we'll be in contact with you to get your prize, okay?
All right.
All right, let's do it again.
Thank you.
No problem. Do we have a Jeremiah in the chat?
Yeah, I'm speaking.
All right, great. Do you mind dropping your email address in the chat?
Yeah.
Okay, great. Just do that for me, okay? And we're gonna do one more. Do we have our winner?
Is that Dorothy?
Dorothy?
Is that Dorothy Norris?
I do believe it's Dorothy.
Okay, that's me.
Okay, do you mind dropping your email address in the chat?
I don't know how to do that really.
Okay. Well, if you can email Friend Health, and that's Friend Health Marketing, friendhealthmarketing@gmail.com.
Okay.
And if you email that email address, I will reply to you so that you can claim your prize, okay?
Okay.
Great. Well, that is it for the end of our raffle.